Every year, 160,000 men in the U.S. are diagnosed with prostate cancer. But a diagnosis doesn't mean it's time to panic. In tonight's Wear the Gown, Eyewitness News reporter Jeremy Baker speaks with the experts in the health system who tell us about the many ways prostate cancer can be treated.
Finding prostate cancer is not the end of the road. The most important thing is to tailor the treatment according to the aggressiveness of the prostate cancer.
Dr. Ahmed Mansour, an assistant professor at UT Health San Antonio, who also sees patients within the university health system.
Since prostate cancer typically progresses very slowly, sometimes active surveillance is all that's needed.
With active surveillance, they are being followed with regular PSAs and exams, and based on the behavior of cancer, they are offered treatment down the road or not.
The second form of treatment is surgery, called a prostatectomy.
Surgical treatment has progressed a lot over the past few years, especially with the maturation of robotic surgery, which has now become the normal standard in offering prostatectomy for patients.
This involves separating the prostate from the bladder and urethra and reconnecting them again. With this surgery, one side effect is sexual dysfunction. But with the advancement of robotic surgery like you are seeing here, that side effect is becoming less severe.
We are able to preserve the nerves surrounding the prostate in a more efficient way.
Option number 3 is targeted radiation.
Technologies which are being utilized by radiation oncologists in order to target the prostate with radiation.
Bottom line, a prostate cancer diagnosis is not the end of the world. It is the start of a conversation of which path to take with your doctor to get treatment. Jeremy Baker, KENS 5 Eyewitness News.
For more information about family health, call 210-358-3045. You can also find the rest of the Wear the Gown stories. Just go to wearthegown.com.